Hello everyone, I hope you're all well and having a nice weekend. Today I want to talk about Tipplasty surgery under local anesthetics. What are the differences between full rhinoplasty, what are the limitations of what we cannot promise to the patients and what we can achieve with the Tipplasty. So Tipplasty surgery is mainly focused on the tip as it's called, and we start the surgery with injecting some local anesthetics outside the skin and inside your septum, and we wait about 10 minutes and then we will start the surgery with a W incision in front of the columella. Then we lift the skin all the way up to the cartilaginous dorsum, no more. This is one of the most important difference between the full rhinoplasty and Tipplasty. We don't need to dissect tissues, open the skin all the way up to the nasal bone, so we can leave it only on the tip area. Then if the patient is having a problem with the bulbous tip, we just trim the cartilages on the tip, we suture them, that's it, that's the end of the surgery. If the patient is having a nostril asymmetry, we resect some of the skin with a different incision outside, we suture them, that's it, end of the surgery. If the patient has breathing problems as well, during the Tipplasty surgery, we can also correct the problems in the septum as well. So the Tipplasty surgery can be nicely combined with septoplasty surgery, which also improves the breathing as well. Also correcting the septum problems, we'll be able to correct the nostril asymmetries as well. So we can also have the septal grafts, cartilage grafts from inside your septum to be used on the tip if you're needing more, if more definition is needed, more lifting is required on the tip. So many patients are asking, can we get rid of my hump or can we narrow the bones with the Tipplasty? Unfortunately no, because during the Tipplasty we don't expose the nasal bones and we don't do fractures to reshape the nasal bones. We can trim a little bit of hump if the hump is really small and mainly on the cartilage, not very on the bone. You can just trim it nicely and it just goes away. But if it's like a big hump, wide nasal bones, you can't achieve good results with the Tipplasty. You will need to have like full rhinoplasty. With the Tipplasty, we can you don't need to have any further, bandages, any further internal dressings, any further nasal splints or casts outside the nose, and you won't have any bruising around the eyes, on the nose, as we are not touching to the nasal bones. So the recovery is faster. It's like 3 to 4 days time. You just go back to your normal life. You can just start exercises for the next week, and you don't need to worry about, the ice packs and stuff that we normally require after normal rhinoplasty. What are the limitations? As I said, the main limitation is if the patient has like a big hump and wide, the other wide actually nasal bones, you can't achieve a good result with the Tipplasty. If the patient has a nice bridge and just a bit bulbous and droopy tip, that's the most ideal patient for Tipplasty. So we can get rid of this fullness here and then lift the tip nicely with the local anesthetic and the local anesthetics actually. What else we can say? The Tipplasty, it takes about 45 minutes, an hour, depending on the problem. And you can also combine the allar-based surgery with the Tipplasty. And also, as I said, septoplasty can be nicely done alongside with the Tipplasty to improve the breathing as well. So if you have further questions, please don't hesitate to contact me. You can just comment on here to ask further questions, but these are the most common questions about Tipplasty under local anesthetics. And I will see you in the office when you need a consultation. Stay safe.